Good morning, Honorable Minister, Mr. Jain, Mr. and other distinguished guests and officials of Government of Rajasthan. Believe me, words are inadequate to express my deep gratitude for the privilege I have to present our thoughts to this August forum. We in Vodafone are actively engaged in various initiatives related to social sector and especially health. While I was preparing myself for this forum, I understand that in India we spend 4.1% of our GDP in healthcare, but there is a dismal expense in terms of public healthcare, which is 1.2%, and globally we are the lowest in terms of healthcare IT interventions. That dichotomy is that there is a huge rural and urban divide. There is a high out-of-pocket expenses, and one of the biggest expense the rural India especially incur in their healthcare initiative is repetitive and very lengthy diagnostic reports and expenses. The repetition of diagnostic tests is so financially burdened that people do not go back to a doctor because they don't have money. There is no maintenance of record today in most of the rural India, forcing the rural citizen to go for repetitive checks for the same disease, and ultimately the prognosis is such that they are unbearable due to heavy expense. In terms of infrastructure and manpower, 0.6% physician is available for 1,000 population. No central regulatory authority for policy making. So, the healthcare is a clear priority, and under the Digital India initiative of Prime Minister Modi, the 2015-16 budget, it allocates a sufficient fund. But as per our understanding, some of the key recommendations which need to be still implemented is to raise the FDI limit to 49%. Unless that happens, the money and the technology will be a distant dream. Setting up more medical institutions for better training with the stature of All India Institute of Medical Sciences, increased number of medical colleges, and connectivity to be provided to rural India to expand the reach of telemedicine. However, the Indian healthcare expenditure is still among the lowest globally, as I said earlier. There are significant challenges to be addressed both in terms of accessibility of healthcare, service and quality of patient care, while this represents a significant opportunity to the private sector to have a public and government partnership with a private operator like us. The other problem which is very unique in health sector is that despite huge grant and money available to each state government, most of the state governments are unable to use those money. As per us, the technology really can change the face of healthcare in India. Like almost every sector, technology can bring a digital transformation, the way doctor-patient interact, the healthcare services are delivered. There are ways to, on a mobility platform, before a doctor goes to a patient, the complete data in terms of his last test, last visit, and the discharge summary is available through a mobile platform. One of the biggest problems any Indian citizen faces in India is the non-availability of bed. It is essentially because the discharge summary in a government office, a government hospital, would take between 3 hours to 9 hours. Although the patient is healthy, is able to go home, to the cumbersome process of discharging a patient from a hospital, ensure that the other patient who is waiting for a bed is not allocated. In the mobility platform, especially in wireless, because that's the media of technology and communication, the improved patient experience is one of the need of ours. The cost-effective automated processes, modernization of medical care with reduced cost to avoid redundant and duplicate manual processes where you go for repeat expensive tests can be avoided. Increase of adoption of telemedicine, electronic health record, M-Health, and web-based services for ASHA workers and A&M workers is the way forward, which is possible through deployment of robust IT infrastructure to handle the patient data digitally. Connectivity of city and rural healthcare unit will be another area where the government should participate and actively think about it. What I am trying to say is that this is a time where we really mobilize the current way of patient care. As a telecom service provider, we play a role of identifying the current processes of each and every health center. Through our expertise and our partner ecosystem, we automate those processes. But the main advantage with partnering with us is we mobilize those processes. In state of Gujarat, Haryana, Assam, and many other states, we actively participate with ASHA workers and A&M workers who ensures that each and every data related to a pregnant woman is captured. Due to such initiative, 4.9% of infant mortality rate in Gujarat has come down. And that was one of the initiatives which we took. While we struggle in our various day-to-day social infrastructure, imagine that there is a cholera in a state A, and all of a sudden there is a complete depletion of a cholera medicine, but you never know that a state B, where huge amount of cholera medicine is available and is going to expire. The only way you can manage this diverse population of our Indian society is to have an inventory management. Imagine in a state like Rajasthan, which is geographically very spread, if you have an inventory management and through few buttons of mobile phone, if you know what is the stock of a very critical medicine lying where, you will be able to really logistically manage and ensure an immediate recovery from a disaster. Digitization of record, the way most of the data which is now available in cloud through a hosted system. On 6th of July, Prime Minister Modi launched Digital Locker. I'll try and simplify what is a digital locker. Right from the day we get a birth certificate and the last certificate is your death certificate. In this journey, we actually acquire 12 certificates as a citizen of India. Unfortunately, if you go and apply for a particular license, which could be a driving license, could be a passport, Aadhaar card, you still need to identify yourself. And the identification is a photocopy which is notarized by a person, is submitted to the same office, and then you become eligible for a particular permission. What we are saying is that all these 12 certificates are actually issued by Government of India. Why Government of India wants it back? And then there is the work of and relevance of digital law, where all these certificates will be hosted in a cloud through a system which will be created and saved in a data center. And as and when any citizen needs any authentication or permission, he or she goes with the access of 12 various certificates are provided, and through a soft copy transfer, that ministry, that department goes on issuing various types of permissions. Similarly, what if we launch those data related to healthcare? A child, an infant is born today, 10th July 2015, and right from that day, the complete data and the care and the disease and the prognosis and the diagnosis is available through a single click of a button. So what happens? Due to technological advancement, application is available through which you mobilize and ensure that the complete healthcare data of a citizen of our country is available at a real time. So that's my point. Which also ensures that the rural India has an equal access to modern healthcare. The government is taking steps in that direction. National Medical College Network, we are actively participating in National Medical College Network. This is an initiative of a backbone of fiber, which is created by National Informatics Center NIC under NKN, which is National Knowledge Network. It's a Government of India initiative on which National Medical College Network will work. Mobile medical units, mother and child tracking system, which I mentioned earlier, health management and information system is the the wider platform where your inventory management, your OPD and IPD appointment booking, discharge summary, and management of complete healthcare data will be maintained. And of course, integrated disease surveillance program, which is another initiative of government. What I'm trying to explain is that Vodafone, as a telecom service provider, also offers you non-replicable, convenient technology on your move. As I said, that our core competence is identify current processes, automate it through unique development of applications, ensure that it is loaded in your mobile phone. Need not to be a smartphone. A mobile phone of 2,000 rupees would also have those facilities. And on the move, you can access those data. Our mobility voice and USSC system, especially National Rural Health Mission, Health Mission Directorate, all these are current usage. Increase reach and influence participation. In fact, in Tanzania, we have created various applications for rural health, which is a benchmark for the worldwide audience. Recently, we partnered with Indian Academy of Pediatrics to launch Health Phone program, which is the world's largest digital mass education program, taking challenge of malnutrition of women. In addition to this, we have a unique product, M-PESA. The biggest challenge of Indian rural society is that non-availability of bank. Substantial portion of our citizens do not have bank account, despite a very big effort which was very successful. If at all they have a bank account, on an average they have to travel between 9 to 10 kilometers. Vodafone offers M-PESA. This M-PESA is a product through which you can transfer or receive money through a mobile phone, which is cashless. It ensures that any kind of subsidy, without any mediocrity or medium interface, it reaches to the actual beneficiary. I urge that we should be given a chance to demonstrate that. Remote monitoring, as Mr. Jain mentioned, we are actively engaged in various telemedicine facilities. In fact, our unique solution, SMS for Life, supports more than 5,000 facilities in Tanzania to track various levels of healthcare, which includes stock levels, using text messages, benefiting health care providers, patients, and ensuring that proper health support is available. Your vision communications, seamless connectivity and reach, which we provide, and especially in Rajasthan, we are one of the largest network service provider of telecom, where we reach most of the places. In fact, I'm very proud to share with the distinguished guest here that the first digital India panchayat level connectivity is going to happen in Rajasthan, and it is our privilege that we are the service provider. This is the first place in our Vodafone as a total communication partner, although we are the global leaders, but we have the local roots. We are an Indian company with a huge amount of infrastructure and investment, which goes close to 80,000 crores. We have required fiber to ensure that various type of data is transported and received. I personally comment on behalf of Vodafone that our expertise, our trained people will ensure that your plans are implemented as far as health sector is concerned. Thank you very much.